If you have been diagnosed with venous disease, you may have seen the acronym CEAP in your chart. CEAP is a classification that helps doctors and insurance determine the severity of the venous disease. CEAP stands for Clinical, Etiology, Anatomy, and Pathophysiology. Today, we're going to focus on the clinical aspect because that's what patients care about and that's what they're more interested in. And the clinical grades go from 0 to 6, being the more severe. 0 means you have no physical signs of varicose veins. You may still have heaviness and pain in the legs, but you don't have any visible veins. C1, which is grade 1, that's when you have spider veins or reticular veins, which are those millimeter or sub-millimeter veins. They're purplish or bluish and they're under the skin, very superficial, but they don't provide any bulge. You can see them, but you can't really feel them. C2 is when you have visible varicose veins, which are those elevated veins that look like a bag of worms underneath the skin. They can be twisted and ugly. They can be large. People don't like them. C3 is when you have leg swelling, also in medical terms called leg edema, when your ankle swells. C4 is when you have skin changes. Your skin may become brownish, it may become thickened, it may become dry. It's called venous eczema. And that's when things start getting more severe. C5 is when you had a history of an ulcer that was caused by venous problems and the ulcer had healed. So now you don't have an ulcer, but you had one in the past and you have a scar there. And finally, C6 is when you have an active ulcer that is having difficulty healing. And that is the more severe case of venous disease. And how is this helpful? Well, it helps doctor communicates between doctors and with insurances and helps them track the severity of venous disease over time. It's also important to determine the best treatment and to get insurance authorization for any necessary procedures. It's like a grading scale for your veins, and the earliest we catch the problem, the easier it is to treat. The key is not to wait. Vein disease can be progressive and can get worse over time. So we don't want to wait until it gets in the latest stages. If you think you have vein disease, you should seek an opinion from a vein specialist. This is Minimally Invasive Insights, and I'm Dr. Fabio Komlos.